Hello, good morning, at least here in Europe. I see also that people from other regions have joined, so good morning, good afternoon, good evening. So welcome at our Occupational Exposome week. So this is the second session. Yesterday we had already a session on Eurogem. Today we are more focusing on exposure assessment from an exposome approach, because we organize this from two exposome projects, both focusing on occupational health, so the EPHOR project and the EXIMIUS project, and we are jointly both member of the EHEN, which is a cluster of 9 European exposome projects. So today, first speaker is Steven Verpaele. Steven Verpaele is an environmental chemist, trained at the University of Ghent, but he is also the president of the Belgian Center of Occupational Hygiene, which is a non-profit organization in research and focusing really on occupational hygiene. And he is also involved in the ISO TC 146. So he's going to present many issues around assessing the workplace exposure during his talk, the next 35 minutes. So Steven, please take the floor.
Thank you, Pieter. I hope everyone can hear me well. If it's not the case, please leave a message in the chat. So yes, indeed, I will talk about exposure assessment, and now I try to figure out, here it is. So, well, my title is Workplace Exposure Assessment, Setting the Standard, because, well, you probably have heard from Pieter that I'm actually currently chairing the ISO working group on workplace air, which means that, I'm quite involved for many years in standardization. And I feel I feel it is a bit of pity that people are not really referring to the standards if they are doing things which are, then end up in not really harmonized procedures. So I will talk a bit about the exposure assessment done within the EXIMIUS project and how we set up, a scheme on how to do that properly. It is a stepwise approach. So I will go into, let's say, the 8 steps where we discuss different things. And so you see here the overview. And I will go to each step to show you at the end what it looks like on how we assessed actually the workers' exposure within the project. So, the first step, gathering general information. So, what we try to do is, to evaluate the group at risk. So, we also ask for example, a history of health effects, history of exposures that are available. And then, of course, we always perform visits at workplaces to identify specific tasks, processes, that can cause a certain exposure to chemical agents. Of course, the main focus was on chemical agents, but that doesn't necessarily mean that we only look into chemical agents, because, sometimes we see an issue on some physical agents, but also, sometimes biological as well. So we capture as much as we can during those visits, and then create some kind of list of all the products and specific chemicals used in different workplaces, tasks, and processes. And here I deviate already because it's quite important to not only look into the workplace as such, but also, look at specific tasks or specific processes, because out of safety data sheets, probably you cannot get all the information you really want, because there can be certain chemicals that are formed during certain tasks or processes. And then we identify, also, that's what I said, formed and released chemical agents for each of those specific workplaces, tasks, and processes. So initial risk analysis, mainly based on the control, it's exposure risk analysis, of course. I don't want to, because I do know that within the different groups you are working together, toxicologists have another definition of risk assessment than industrial hygienists. And here, we mainly talk about exposure, the risk analysis of risk assessment. So, well, the first step is mainly that we look into control hazard banding. And the main reason we do that is because, if you go to workplace, everyone knows that we have a huge mix of chemical agents there. And so just to give you an idea, if we look into, the workplaces that we visited during the EXIMIOUS project, I believe, we ended up with at least, 5-6 pages of chemicals. So, that's a big mix that you need to control. And the main thing you want to do is prioritize, to really look, what is really important for a certain target organ or, the effect that you want to evaluate. So, this is the main thing. The first thing is mainly on hazard banding. So you look into the hazard of the individual components. But you can also do it, for example, at product level. If you have too many substances there used, well, probably you first prioritize on product level, and then you narrow it down really at specific chemical agent level. So this is a bit the outcome. So, well, this is a 5-band system, which is the original one. If you look into the HSE original BeCOH, you see we used 5 bands. There are also tools that are using less bands, and even tools that are using more bands, but that is not really of importance here. And the important thing is that you have an idea out of your whole list what is becoming a bit, in the middle, in the yellow, orange, and red, and those are probably the ones that needs to move forward for your specific assessment. So red, orange, yellow, further processed. So that means that you already prioritize quite a lot just on classification of substances, which already allows you to really look deeper into what really matters. And especially, of course, the red ones are the ones that are most important. So you will see that I will also go deeper into methodologies and so on as well. But what I want to highlight here is that at the beginning, you always try to identify your main effect that you want to evaluate. And so that means that you need to look into a little bit further than only safety data sheets and to the specific components, because you really want to see, what the target organs are and if they are relevant into your specific cohort or any other group of workers. So the fourth step is mainly, high risk chemical agents. So, and there you have different routes to follow as a follow-up. And because, you can imagine that if as soon as you start using semi-quantitative tools like models or more quantitative assessment, this means that you always compare to prioritize with certain limit values that are available. But of course, we all know that, many of the components or the chemical agents we are working with don't really have a quite straightforward limit value. So you need to, divide it into different groups. And in this case, for example, you ask the question, well, is there a limit value available? Is it an inhalation limit value? Is it a biological limit value? Or whatever limit value you find? And if the answer is yes, the first thing you need to investigate is that, is that protective to health? So meaning, is it a health-based limit value? Of course, if it is not health-based, you will end up in another route. I will show that later. And, there is also the possibility that there is no limit value at all. And I have to say, in the workplaces we visited, at least, and this goes over 50% of some substances we identified had no limit value at all. So then you need to look into the prevention hierarchy. That's, occupational hygiene practice to see, can you replace it? In many cases, it's not possible because it's process or substance specific use. And so, well, of course, if not, you have to look into more detailed information. So then, of course, you need to look into the background information on effect threshold. And can you find somewhere, for example, a no observed adverse effect level, or any other toxicological value that can be of interest in your investigation? And then, if you have done that whole research, you move forward to step 5, where you see here different outcomes. Mainly, you split it already into 2 pathways of exposure. And so, meaning that the main routes of exposure in workers' exposure are skin or dermal exposure and through inhalation. Of course, we all know that probably the best established limit values and so on are through inhalation. Dermal exposure is definitely something that we further need to look into, but because there is not that much information available. But anyway, you already split it here, and depending, on the background information on the limits you found, you will see that, you have different outcomes here. What stays red or still belongs to the orange groups or whatever. So the first one is actually there is a limit value available, and it is a health-based one. Well, here it's very clear. If you do modeling, for example, and you're above the limit value, it remains red in your prioritization. If it's below the limit value, it turns up green. The second is when you have a limit value, and the threshold is available. So there is a threshold for effect, but it's not set at a limit value, and this can have several reasons. For example, because you do know many carcinogens, mutagens, and reprotoxic agents do have also a socioeconomic component in different countries, which means that they are mainly not set at the end at the threshold, the health effect threshold, but somewhat higher, which means that the outcome can be quite different. So you can only turn up green in your prioritization if you are below that threshold. If you are between the threshold and the limit value, it remains orange. And of course, exceeding limit value stays red. Well, where there is a limit value but no threshold, of course, here this is a bit difficult, and those are probably the routes that still need to move forward into a measurement campaign, and because you can never end up in a green situation here to leave them out in your prioritization. Here in this case, even below limit value, you stay in an orange setting. And, in cases where no limit value is available, for example, in many cases, what happens then is that people set their own limit values. And so, this is very known out of the pharmaceutical industry, where they do that quite often with the active ingredients. So, but we call it a bit like kickoff value, which is actually some kind of distribution of substances with a limit value, related to specific hazard categories, and you do some statistics on it, and you take the 10th percentile of the substances with a limit value of that distribution in a specific hazard category. But anyway, in this case, you will also end up never with a green situation, because it has a high uncertainty. So, the 6th step, and here I go already into, the standards, of course, because, this is the scheme of EN 689, which is, in the occupational exposure assessment, the compliance standard. The pity is that it is only in Europe, a European standard. It's not an international one. But anyway, it is referenced in many other jurisdictions than Europe as well. And of course, I just want to highlight here, in this block, that there is some kind of, investigation needed for the measurement procedure. And I want to just highlight this because in many cases, if you use the wrong measurement procedure, you will probably end up with the wrong output or wrong results, which can seriously interfere with your specific outcomes you want to identify related to certain exposure to chemicals. And well, I think, in my opinion, this is the most made mistake actually in the whole exposure assessment scheme, that they don't do that procedure, measurement procedure, fit for purpose test properly. So, well, how do you do that? And now I refer to another standard, of course. That's the European Standard 4A2, which really describes actually the general requirements that are needed for performing workplace exposure assessment. Well, the first thing you want to identify is, in your fit for purpose for methodology is, is my, well, the measurement time of the specific procedure that I will choose. Is it fit for purpose? So can I really identify within a uncertainty boundaries the exposure of the worker within a reasonable time? And so meaning that, if this minimum time is above 8 hours, and you probably have serious issues, and that means that that method is not fit for purpose of the well, for performing the workplace exposure assessment. So here you see what those uncertainty boundaries are in EN 4A2. And so you have to operate within those measurement uncertainty conditions. And people, always say, well, 50% uncertainty, that's a lot. Well, you will see, taken into consideration all uncertainty components, that it's not that much actually. And it is really difficult for many measurement procedures to really go below that 50% of uncertainty. And of course, that is one of the reasons mainly that, for example, although everyone likes it a lot, but I will come to that a bit later because it is in EN 689, that real-time devices can probably not always perform according to those requirements. And so you see it depends a bit on, acute effects measurements, so short-term measurements, or a long-time effect, or, well, where you have, for example, 8-hour limit values, where you see, the only deviation here is if you are between 0.5 and 2 times limit value, that your uncertainty has to be below or equal to 30%, which is already quite low. But all the other ones are actually an uncertainty component of 50%. So, well, this is the relationship between EN 4A2 and EN 689. And so there are 3 purposes for performing measurements. And you will see, if you visit a workplace, of course, to identify certain spots of exposure, you try to evaluate, you screen, let's say, to evaluate variation of concentration in time and space, which is belonging to the basic characterization of your workplace, or you screen to evaluate time weight average concentrations, which is partly to the basic characterization of the sampling strategy. So don't look too much at those pictures, but it's just to highlight, what kind of devices you really need. And the basic characterization, it doesn't really matter, if you are within 50 or 60% uncertainty, who cares? And it's mainly to identify, do you see peaks at certain points, or do you see nothing? If it's particulates, or even if it's solvents or whatever, you see something happening, which means, yeah, probably I need to look further into that. So the second one, if you really have time weight average concentrations, it means your devices need to be at least a bit more sophisticated, because you really need to identify time weight average concentrations, which means that you need to have log functions, of course. Otherwise, you can never identify that. That's why it is a little bit more sophisticated. And of course, if you really want to compare with limit values, this is your sampling strategy, and real exposure measurements. Those are always done personally on the worker, and they require, the very strict uncertainty requirements. So here you see, a picture of inhalation exposure monitoring, and here you see some kind of dermal exposure monitoring, depending on your strategy that you have chosen. So now I go into, the measurement requirements. And I just want to highlight here, what are the important points to look at as soon as you start performing measurements. Well, there are a lot of limiting factors, and depending on the methodologies you use, well, for any active measurement procedure, but for example, well, some of them, of those limiting factors are also valid for diffusion methods. But for all measurement procedures, temperature and relative humidity are, the most limiting factors. And so if you perform measurements and you don't have any idea of your temperature and relative humidity at the time of your measurements, actually, in my opinion, those measurements are not very valuable. And of course, the relative humidity is usually of utmost importance because, they can really the relative humidity can determine, for example, certain polar components, how they are distributed into the workplace air. The second is for active, of course, measurement procedure is the pump back pressure. So, well, you do know that you use a sampling train, which is actually a pump that draws air through a specific substrates, which then goes to analysis. So there is always a back pressure, and so you should always check it before you start sampling with specific substrates. And well, this is an EHEN ISO standard 13137 that describes what are the boundaries of using, pump back pressure. So in this case, for example, you need to make sure that if you have a high back pressure, that your relative difference in flow before and after sampling is always below 5%. And well, here, one of the most important things is that you don't, well, in many cases, people do flow checks with blank substrates, which is not really what you should do. You should check with the same substrate as you take your samples with, because, for example, if you use activated carbon tubes in a workplace with a high humidity, you will see that it will be really difficult to have, let's say, a relative difference in flow rate that is below 5% after you performed the measurements, because that humidity will block, in many cases, the activated carbon in the tube. So another factor is pulsation of the flow rate. And this is mainly important for, but also for solvents. So, if you, connect the pump to a substrate, and you see, for example, in an activated carbon tube that your carbon fraction is actually moving around, well, of course, that means that your pulsation is too high, and well, you will have serious deviations in your actually uptake rate of the specific components you want to determine. So in that standard, it is evaluated that pulsation shall not exceed 11% of the mean volumetric flow rate, which you always have to check, of course. And for particulates, it's of high importance, because if you have a high pulsation, actually the particles fall off the sampling substrate or the filter. So you won't be able to analyze that. So for solvent desorption, this is also standard EHEN ISO 22065, which is, on solvent desorption, your main limiting factor is actually the sorbent, where high polar components may require derivatization before analysis, while agents with very low boiling points are only partially absorbed. And so means that it is more a qualitative estimation instead of a quantitative, and semi-volatiles are fully retained by the sorbent, but only partially desorbed. And so, although you can test it, for example, in lab conditions, it is not always showing the same desorption efficiency as when you really capture them actively. So you need to consider this. So the range of the method depends on the sorption capacity of the sorbent, which you always have to check, the linearity of the range of the gas chromatography column and detector, and detection limits, of course, are very important in that because they are needed to evaluate your minimum sampling time. Well, depends on the noise of the detector and the blank samples, and well, concentration of chemicals that are already present on the sorbents and in the desorption solvents. And for example, it is known that aromatic carbon chains may already be present in activated carbon. And for example, carbon disulfide for desorption is mainly containing a fraction of benzene. So if you want to determine benzene, it can have some issues if you don't investigate that. So retention after sampling is the next limiting factor, is depending on the volatility. So if you have boiling points between 0 or below 0 and 50 degrees Celsius, and you should store your samples at maximum 5 degrees after sampling. And so because otherwise, you have a chance they will desorb during transport. And of course, all others should be stored in solvent-free containers at room temperature. And of course, one of the most important limiting factors is also the desorption solvents, which really depends on the type of components you want to determine. So you have, within that standard also different desorptions, which means in this case, we talk about thermal desorption tubes. And so here, you have the choice of sorbent, which is really important because for thermal desorption, you have many more different choices of sorbents compared to solvent desorption. And because, your solvent will also have a serious impact on your choice of sorbent, but for thermal, of course, you don't really have that issue, and you can, definitely have a lot of different sorbents that you can choose out. So, the specific components require different phases, for example, in thermal desorption tubes. And of course, the main drivers for absorption are the surface, spore size, spore shape, and the porosity of the substrate. Sorbent and analytical device. Here, of course, the same linearity depends on your column and detector, and the noise, blank samples and regenerated samples will determine your detection limits. And so regeneration, because, those are tubes that are reused, and so they need regeneration, but every time you do regeneration, actually your absorption capacity changes slightly. So meaning that your detection limits, if it always remain the same, I already have serious doubts about, a well-validated method, honestly. So pump flow rate must be high enough, and because, many people are doing very low flow rates for thermal desorption, but the main issue is if they are too low, depending on the sorbent you have chosen, you can have even diffusion without diffusion of those components on the sorbent that are not really driven by your pump flow rate, but just by the diffusion constants of the substance and the sorbent. If you have this, it means that you will have a serious overestimation of the real concentration. So retention after sampling, and so sorbents are chosen according to the chemicals you want to sample. So you have to make sure that they are stored at room temperature in a solvent-free container, because you can have diffusion of those components anyway into thermal desorption tubes, and you will find them. And of course, shield them from direct sunlight. If you use glass tubes, for example, in the case of nitrosamines, which are, big packed thermal desorption tubes, those are glass tubes, so you need to protect them from sunlight. So the limiting factor can also be the cold trap sorbent part, which can be very component specific, and you should be aware of it, no matter what kind of phases you use in your thermal desorption tube. sometimes, your cold trap is not even capable of trapping those specific components, which means that, well, you capture them, but you will never analyze them properly. So definitely something to look at. So another active sampling methodology that is in that standard are coated sorbents for specific components like aldehydes, diisocyanates, peracetic acid, and so on. And so, well, here, of course, you have an additional limiting factor, which is actually the reagent that is coated on your carrier. And of course, this is a very component-specific reaction, and there is only formation until the coated reagent is used up. And so if you do know, for example, that you have certain concentrations that can really go into that region, that you don't have enough of that coated reagent, you need to be very careful, because you end up with always the same concentration, which actually means that this is just the reagent concentration of that specific component. And of course, the flow rate is very important here. You always need to check as a limiting factor, because you have a reaction on substrate, it means that you need a certain reaction time, and that reaction time will really depend on the flow rate. For passive sampling, the main limiting factor is the absorption rate. So, the main thing is that you can only determine the chemicals for which the absorption rate is determined, and mainly, depending on the different passive diffusion tubes, you will have a list of substances where it is determined for. And so any of the other that are present will be taken up, but you have to be aware that you cannot really determine them quantitatively. So limiting factor, wind speed and direction. And so, I see many people using diffusion because it's easy, and they hang them up everywhere, in cellars and indoor environments and so on. Well, if you don't have an airspeed, crossing the absorption layer, you won't have any diffusion. And that is actually the graph that is showing that. And so you need a minimum airspeed that is passing over the absorption surface to have the reaction of diffusion going to happen. And of course, there is also maximum airspeed. If the airspeed is too big, you won't even have any diffusion. And so, very important for people who are using those things, and because I've seen them used in many situations where I find it quite normal that nobody ever measure anything, because, if you do that outside, for example, stationary on a fence, I'm not really surprised that you don't measure anything, because you exceed maximum airspeed here. So measurement time and diffusion is a lot slower than active sampling. And so minimum measurement time is very important. And of course, the back diffusion is also quite important. And so when you have significant variations in air concentrations, and that is something you need to investigate in your initial workplace visit. If you have high peaks, for example, that means that your sampling efficiency will go down very easily on those sampling. Whole air canisters is an ASTM standard, mainly for the low carbon hydrocarbons. Of course, the limiting factor is the volume that is sampled, is depending on the size, of course, of the canister, and cleaning. So very difficult to clean, and you can have a high risk of contamination from previous sampling, especially if you have very difficult components in your air, like aldehydes and so on, which stick to the walls of those canisters. So for particles, there are two standards, 481 and ISO 7708, where here I show you the difference, and that is important, especially for people who think, that they have the right, let's say, device. So many of the real-time devices are using PM fractions. Of course, our conventions in workplace air are not exactly the same as PM fractions, so you need to be aware of that. And of course, if your sampling convention is deviating too much and you have a lot of particle sizes that are in the ranges where it starts deviating, you need to be very careful how to handle the result. So differences of samplers, and so there, it is identified that there are important differences between samplers. Bias maps are not available for all samplers. And of course, EN 13205 is a standard where a lot is going on actually currently to set up new procedures for testing the samplers according to their sampling efficiency. And this is all done within the International Sample Comparison Group. And so here you see an example. For example, just the orientation of your sampler will give you a completely different sampling efficiency. And so you should be aware of it if you use certain samplers in certain atmospheres, how they will, what their efficiency is within your specific requirements. And so here the same, if you put them straight forward or under a 47-degree angle, as everyone says, you see that actually their efficiency changes significantly. So the location of the sampler in the breeding zone, and so, you should investigate that and ask the workers, if they are, right or left bearing, performing their job, because you can have huge differences when you really place your sampler if you perform personal measurements. And so, if you have tasks that are involving projection of particles, for example, grinding, this can have a serious implication on your results. And so if you're right-handed, you will sample more on the left. So especially if you have projected particles. So when you install sampling equipment, you should all take this into consideration. The sampling substrate is another limiting factor based on weighing stability, hygroscopicity, background concentration, sampling efficiency in a well-defined sampler, and, for example, reaction with extraction agents, for example, if you use metal speciation protocols. So wall deposits is another one that is currently known. So, all samplers have internal wall deposits and you should consider them, which means that you have to take that into consideration if you perform particle measurements. And then the analytical procedure, and I see, I just finish all those things. Particle size dependence, okay. You will have particle size dependence on the analytical devices, on the distribution on your substrate, especially if you have direct on filter analysis. For example, elemental carbon for diesel exhaust, where you really punch out as part of the substrate. Well, there you can have serious differences depending on which part you punch out. Mixed phase samplers, so this is for the mixture of particles and volatiles. So they are, of course, having serious issues with sampling substrates because, you have to sample at different flow rates normally to capture particles or, liquid particles and volatiles. But now you combine them. So you need to make sure that you find the right spot for your semi-volatiles you want to sample. And the main driver is the particle aerosol lifetime and, let's say, your semi-volatility coefficient, which are all described in the standards, how you identify those, and how you have to identify if your result is actually performed well, or you need to probably use another technique or another flow rate to sample those substances. And so, all those factors that I describe here are really fully described in the standards and need to be considered before you use those methodologies. Biological monitoring is also important. You need to identify fit for purpose. And then, of course, stationary measurements, as I mentioned, are identified, used for identifying background exposure, but don't have any other meaning that they are more in the semi-qualitative exposure assessment strategies and not really in the quantitative ones. So, then you collect your measurements and you have to consider cumulative exposure indexes by using tools like, for example, IRSST MIXI or ENRS MIXI for, well, here is an example for target organ effects depending on different metals and metalloids, quartz, inhalable dust, respirable dust, that can all have additional effects. And of course, at the end, you have a very clear result of your measurements on exposure. And this is just, one of the SAGs we had in our EXIMIUS project, which really shows, for example, well, those are the chemicals that can have most effect on those specific target organs. And of course, all those things needs to be linked to the medical profile of the workers, of course, to make sure that people have some medical follow-up. But it's very important, if you use this, well, here it is very clear, that dermal exposure will probably be the driver of the exposure. And mainly inhalation is important, but not as important as dermal exposure. So probably you need to shift a bit more into the dermal exposure assessment route, which also means that probably, if you have biological monitoring probabilities and you use them together with your results from dermal and inhalation monitoring, you can probably have a very good output. And this is the total overview of everything I just talked about. Well, I'm actually writing this up in a chapter in the Handbook of Occupational Health and Safety. And so it's not finished yet, but I hope actually that this is all published beginning of next year. And I think, this is a list that I want to give for everything on the important international standards I talked about today. And if you need any further information, I'm happy to answer any question or remark. Thank you.
Thank you, Stephen, for this, nice and exhaustive, a bit exhaustive, at least if you're not in the field, I think, overview. So I see a few questions. Yes, I did not say this in the beginning, but the talks are recorded, and so you will have the possibility later to see again and this overview and possibly also the slides. But I have here a question of Esther van Zandt. It's more really on particles. So we are planning to measure talc because proposed CLP classifications, exposure is around 1.52 hours for our operators. How to determine whether this is a correct measurement time according to the EN 482 or maybe another one. No new OLs have been derived for the proposed CMR classification. Which value to use is the question. It's maybe a very
it's a difficult question, and it probably requires quite a lot of, let's say, explanation. Well, how to determine that? Well, I think my formula is in the slide deck, so you can still look back to it. So, of course, if you don't have a limit value, you already have a problem because it's one of the factors in the formula. So what I would propose is really to look into, for example, similar classification and set up your own value or range of values you think you will end up in. And then, of course, you need to look into your laboratory method. And well, because, talc, in many cases, it is determined gravimetrically. Well, in the old days, if the limit value, of course, goes down quite a lot, you will see that gravimetric analysis won't be possible anymore. And I do think, that probably XRD methodologies will be the most appropriate one to move forward. And then you need to look into those validation criteria and look what the limit values or the detection limits are that they can establish. And so, I do know I'm also busy with that talk thing, so I do know a lot about it. So you can always contact me, and because we are also struggling a bit currently, because I think what I have seen showing up, if that limit value goes really into that direction, it will be a serious issue because there is no really fit for purpose method available to do that properly quantitatively. And that's what I can tell already.
Okay, so yeah, that was already a very detailed answer on a very difficult issue, I thought, but maybe you can have contact one-on-one
Yes.
to have more discussions. And then there is another question from Tatpong. Would you recommend using passive samplers to assess workers' exposure to chemical and compare with OL?
Well, I don't recommend anything before you tested the fit for purpose, and that's what I try to say today in that presentation. And so I am not recommending passive sampling. I think it is a sampling methodology, and if it is fit for purpose for your assessment, you can use it. But recommend it already from the start without knowing anything related to the workplace is a bit tricky. You cannot do that.
Okay, so the fit for purpose is a key issue here.
Yeah.
Okay, and then another one from Susanna Viegas.
Oh yeah.
So first, thank you, and then importance of using biomonitoring for having complementary information on total body burden of the substance, other exposure routes, and so on. Yeah.
Correct. So, well, that's what I do know that I was a bit out of time range, but that's what I try to highlight, Susanna, at the end. And so if you have identified your target organs and you see, for example, well, mainly, dermal exposure, well, this is an issue, and more components have really, shifting into that direction that they're more, let's say, important for dermal exposure compared to inhalation. Well, of course, if you have the total body burden and you complement this with inhalation and dermal exposure, you can do very great things with all this information. So I do, acknowledge that biomonitoring, although, we definitely need standards, and I'm working on it, honestly. So within our working group, I think on the dermal exposure, we have just finished our first standard. From a multi-part standard, I'm definitely sure that we will have a part on biomonitoring and the importance of including total body burden results into the exposure assessment, into the exposure assessment strategy, definitely.
Okay, thank you. Yeah. I do not see direct questions for Stephen at this moment, so I suggest. So first, thank you very much, Stephen, for this very nice overview. I see one hand up here. I don't know if I can let you speak, Gertsen. So yeah, your microphone is active. Goitsema. Oh, it's again off.
Okay. Can you hear me?
Yes.
Okay, thank you very much. My name is Huitiman Keretete from South Africa. Thank you very much, Stephen, for that comprehensive presentation. I just wanted to find out, you spoke about minimum and maximum airspeed. I think most of the time when we do passive sampling, we think a lot about the minimum airspeed as a limiting factor. And you touched on something very important, a lot of fence line measurements that are done. You indicated that the maximum airspeed would be a limiting factor for one to consider. Can you just maybe advise how to overcome that when one is doing fence line monitoring? Thank you.
Difficult question as well. So, well, you need to be a bit careful. So, of course, you always have, the major wind direction. And so you need to be a bit careful that you don't, let's say, go into a 90 angle degree on the wind as well, because then you will have, let's say, accelerated diffusion. So it is somewhat, you need to make sure that the right angle is there. And it's really difficult, especially if you have, turbulent regions and so on. I would say that if you exceed, and you can take a look, it is really depending on what kind of diffusion system you use. But if you exceed the maximum airspeed, I would not recommend to take any sample. And because, the thing is that it is really difficult to place it then in the right direction. And you do know that, even if you have a certain wind direction, it can change. There can be turbulent areas and so on. And you will have a complete disturbed, actually, diffusion process. And so, yeah, that's my recommendation. I have done many of those things and hang them in different directions. And you see, at the end, you get a range of results and you're not really sure, what is now the real exposure here? Is it, the average of those? What is it? And so it's really difficult.
Okay, thank you, Stephen, and thank you again. But I have to wrap up this part, and I suggest that the next speaker, Rani, Claus. But at the end, there is probably, hopefully, still some more room for questions. So Rani, Claus, she is a PhD student as a pharmacist, but really went into sampling and sampling methodology, conducted a lot of low at the spot measurements already. So although maybe young, quite experienced in this task, and she's gonna give you kind of view on issues that you can come across and how to solve, maybe sometimes on the spot, because there is a lot of things you have to do, but sometimes you have to work also with the reality, and that is what she will try to show. So Rani, please, your presentation.
Yes. Good morning or good afternoon, wherever you are. So thank you, Pieter, for the introduction. And of course, I'm going to talk a little bit more about practical considerations for sampling campaigns that we also did within the EXIMIUS project. So I just want to give a little warning because I have included some pictures, but I only got agreed to use them for my personal presentations, and they should not be shared or distributed. So if you would want to take some screenshots, you can, but please don't take the parts where the pictures are on. So as Stephen also already mentioned a little bit, so we have different routes of exposure. So of course, we focus mostly on inhalation and dermal exposure. Ingestion can happen, but it's less seen as an occupational route. And when inhalation and dermal exposure happens, it can be taken up via the circular blood system. And we can also talk about systemic health effects. And these effects, of course, as also mentioned before, we can monitor with urine, so urine biomonitoring, or we can also draw blood to see what is for example, the internal dose of the compound. How can we monitor exposure? This is also mentioned a lot before, but of course we have, for inhalation, we have the active sampling. So of course it requires a flow pump. And as also mentioned before, every compound has specific guidelines for flow rates. And also depending on the media, you need to select the specific sorbent tube or filter, of course, to capture it. So it's always important to check the NIOS or the OSHA sampling methods, and also the EHEN and ISO standards that also has been discussed before. And also mentioned very well, so that it's very important to also calibrate the flow before and after the sampling. So next to the active sampling, we also have a passive sampling, which we can also use, for example, for volatile organic compounds. But of course, we always need to check the fit for purpose before we choose one of these. And there is also a difference between stationary and personal sampling. Then we also have dermal exposure that we can monitor. So we have removal techniques, for example, where we can wipe surfaces, but also the hands or the neck of the participants. And also we have interception techniques where the known ones are the wristbands, for example, and also active charcoal cloth patches that can be used to measure dermal exposure. So where to start? It is a little bit what also Stephen Verpaele mentioned before. So we have the structure of the EN 689. And of course, we really need to start with a basic characterization. So it all starts to really go to check the company. So we need to know a general scheme of the organization, the processes, the task per work area, but also so the overview of the chemical used based on the safety data sheets. But also we cannot forget to take into account the release or the formed chemical agents. It's also important, of course, to review the workplace factors, such as the temperature, ventilation, and also to have already a little bit idea of the exposure levels using, for example, direct readable devices. And of course, before we can start the sampling, we also need to know the total number of employees and also know their history of health effects. And sometimes also they did before exposure measurements. So it's always interesting to also take a look into that. And of course, then construct similar exposure groups or sex. So the next part is then the risk assessment to really see if the estimation of the exposure and to see if it's above the occupational exposure limits. And we do that with a software-based risk inventory and evaluation. Here on your right side, you can see some software that are used. And also mentioned before, we then can use risk prioritization to use then control and hazard banding, and depending then on the color or the outcome, we then carry on further the risk assessment. So an important question always is to ask if the exposure measurements is then needed, because it's also very expensive to do it. And then we also base this based on the similar exposure groups. And then we have different substances. And then the software, for example, they give a daily exposure, and then they compare it to a limit value, and it results in a simulated exposure indices. And when it's then higher than 1, it really say that we cannot say if the exposure is really under control, and then exposure measurements can be needed. And for example, you can then say that you need 6 samples, for example, to identify the exposure. So it is a little bit similar as the previous presentation maybe, but I want to say that the structure of the EN 689 is mainly company driven to comply with occupational exposure limits, but also within EXIMIUS we had to think outside the box, also in general within our research, and we also need to think a little bit about on another point of view, because there are different obstacles to tackle. For example, it's not so easy to enter a company, because if you want to, for example, measure volatile organic compounds, we cannot directly enter the company. We need to have a way to gain the trust of the company of all levels, so not only the management but also the workers. And of course, what mentioned before, practical arrangements are also very important. So that is what I want to talk a little bit now. So I performed the last 2 years a lot of sampling campaigns, and I want to just share with you what we learn as a point of view of an exposure scientist. And then again, where to start. So here I want to point out that it's very important to this kind of things, it actually is by doing. It's an experience. It's to see, to look, and also to reflect and to think about what went good, but also what went wrong, and what can we improve within the next sampling campaign. So I'm gonna give an overview of the difference of some sampling campaigns we did within EXIMIUS, but also outside of EXIMIUS. But I want to say that I take fully responsibility for all the mistakes and deviation that I point out, because when I started this journey, I had no experience or limited knowledge. And when organizing and executing the sampling campaigns, we all did our best at that moment. And I hope we can only learn from the mistakes we made back then. And I hope by sharing this experience and also some challenges we faced, I can also that others also can learn from our mistakes. So the first sampling campaign, so of course I'm not gonna talk a lot about what we really did there, about what the workers were doing, for example. But I'm just gonna give you a little bit of overview of the activities and the tasks. So it was an 8-hour shift, and the workers performed manual and robotic welding, plasma and laser cutting, and X-ray testing. And it's the sampling plan. We followed the workers for 5 days, and personal inhalation and thermal exposure measurements were conducted during the shift, as you can also see on the right part of the slides. And urine samples were collected pre and post shift for the VOC analysis and the metal exposure assessment. But the things I want to mention here is the challenges that we faced during this first sampling campaign is that one of the things was that the worker selection for sampling was unknown in advance, so that it was difficult to discuss before with the workers, to explain, for example, why we were there. So I really felt that was a challenge to face, because you need to, you really see the worker, and then you already need to hang directly a pump and put them some patches. So I had the feeling it's better to have a first meeting up front. Also, there were some language barriers, because neither of the workers nor the management spoke on that moment very well English or my main language, so Dutch. So it was very difficult to communicate with them. And also, there was a limit observation opportunity during the sampling. And this is also one thing I want to point out, that it's not, you cannot hang a pump on a person or put some patches on a person and then just walk away and hope it will all go well. We really need to go and observe within the company. And here it was only one brief check that was possible to see, okay, the pumps are still okay. That was the only thing we could see on that moment. And also, on that moment, our contact person, they selected the workers morely based on the willingness to participate rather than the exposure levels, meaning that there were some deviations from the sampling plan, and that we had to think again outside of the box. For example, that we had to sample an extra shift, and we could not enter the company anymore. So we really retrieved the pumps outside of the company. So me and my colleague, we were really waiting outside of the company just to collect the pumps, because we could not enter inside. So what did we learn, or key learnings? So it's very important to explain the sampling plan to all the stakeholders, and also the responsible researcher should thoroughly understand the sampling process to really explain very well to the company what we were going to do. I also felt that the first time sampling can be very overwhelming and also time intensive for as well the researchers as the workers. And I was very lucky that I had someone in my team that was very experienced already with sampling and all the pre-calibration and the pumps. So this was also helped me very much to with my first sampling campaign. And what was there an advantage is that we had a separate team that was really responsible for drawing and processing the blood samples, so that we only had to focus on the exposure sample. So that was a nice advantage of that sampling campaign. The next sampling campaign, it was a 12-hour shift per day. We followed their sandblasters, controls, and spray painters, and we followed them 2 days, and we did again the full thing. So inhalation, thermal exposure, urine samples, and also blood samples collected post-shift. So the challenge we faced within this sampling campaign was that, there were complaints after day 1 that the sampling campaign delayed the work process. So it was, from my side, I think, not very well communicated what was the impact of, if you follow 10 workers, if you have to hang out pumps, put on patches, take urine samples, it takes some time, of course, and I really need to communicate that a little bit more upfront, that it can have a delay on the work of the workers, of course. There was also weak communication between our company contact and also then within the company, so that results again for some miscommunication. And also there was again a language barrier, so the workers did not speak English or Dutch. So before upfront, our contact person mentioned that the language they spoke was actually Turkish. So we really tried to translate our questionnaires to Turkish, but then it happened actually, or it turned out that the workers were not talking Turkish but Greek, and we really brought in our printer there to really print on the side the new questionnaires. The only thing we could do on that moment was to translate it via the standard Google translation. So it's also not 100% very well done, but yeah, we did not know upfront that the language was Greek. So what we learned from here is that, again, the clear communication with the management, the HSE team, and also the shift leaders is essential, especially when the management and the workers speak different languages. Because the management, they really spoke, or the manager really spoke Dutch or very well English, but it was not very well translated to the workers who spoke then Greek. So this was really something that we had to take in mind. Also, we found out that the questionnaires were very challenging because, normally we validated that questionnaire. We also already had let it filled in by other workers, and they only did it they filled it in in 20 minutes. But now, because it was, I think, also not very well translated very well, it really took 60 minutes again, and that also led to the delaying of the work process. Another thing that we took away from that was that we did not have a dedicated room for the blood sampling. And this is something I really learned, and it's maybe something stupid, but yeah, on that point, we did not really thought about it, but we really did it in the offices of the workers and also in the container where all the pumps were, all the patches were. So we were with 10 people in the same room, and then the physician had to draw the blood. It was not very nice for the physician, also not very nice for the workers. We really took that with us, that we really have to have a separated room for the blood sampling. Then the second sampling campaign, then we went to the firefighters, and also we followed there some office workers, and we followed them for 4 hours. Here we had to do stationary inhalation measurements because it was just not possible to go with the pumps inside of the fire. So that was the reason why we chose that one. And we also performed dermal measurements, and we collected urine samples pre and post shifts for some. The challenges we faced there was that on that moment we did not have a mobile fridge. So it's also something that if I think about it now, it's like, oh, why did we did not think about it? But on that moment we did not have it. So we had to store the urine samples next to the workers' food with this. Of course you work with zip bags and everything, and it's quite okay, but it's not very pleasant to really see your sandwich next to your urine pot. So we really thought after that sampling campaign to buy a mobile fridge so that we really just bring it there and then put all the samples in a separated fridge. Also, in that moment, we forgot the ethanol solution for the dermal wipes. So, and we were a little bit too far from the lab. So we thought about it, and then we did, okay, we're gonna go to the nearest pharmacy, and that challenge was actually very fast, solved. And also in that moment, we had a lack of experience in collecting the inhalation samples of the pHs. So the measurements were also too far from the exposure sites, and the sampling train was also not very well created good. So we really went to the specialists to really learn and train us to how to really do it properly to collect these kind of samples. And also there was only one person that knew of the previous discussions with the workers and the HSE, and we were there with a team of 7 people, and it was not very communicated very well what was discussed and what was actually discussed with the workers. So it also again led to some miscommunication between the whole team. So some key learnings that we had there is that one person should oversee the entire process to manage the measurements, also the workers and the logistics. And it's better also because, yeah, you have then the inhalation samples, you have the dermal samples, you have the urine samples. And at that point, we just all did it together. So it was just like who had hands-free, that would give the person a urine pot, or who had hands-free, they would do wiping. But then we saw that we had some contaminations with that. So it also was good actually to really divide the task between the different researchers, so that one person for example, the dermal measurements, one person does the inhalation, so that it's also one to prevent contamination, but also mistakes, because yeah, if several people are doing the same things, and it's not always very good to avoid their mistakes. So and we also had to change a sampling plan, and that is sometimes I have to say, sometimes you really have to change your sampling plan depending on the situation. But here we did a lot of changes to that sampling plan. So our labels were not right anymore, and I think it should be avoided to do it too much, because at the end, when we went back to the lab, you have to do then the analysis, and it was not very clear, like which label meant this, and there was a pre, and there was a mid shift, there was a post shift, there was a post to shift. It was very confusing for everyone. So yeah, if you change the sampling plan, be aware also that you have time to label it very correctly, because otherwise it can also lead to some mistakes. And at that point, we also prepared everything in little boxes per worker. But then on that moment, I also thought it's better to all collect them together based on the type of the measurement you're gonna do. So for example, if all the pre-shift urines together, all the post blood tubes together, it's better than put everything of worker number 1 in one bag and worker number 2 in one bag. It's something that we also saw that really improved the efficiency later on. Then another sampling campaign that we did was within EXIMIOUS was with the mine workers, and there we also had to do stationary inhalation measurements, and we collected also some dermal wipes and also urine and blood within that sampling campaign. So the challenges that we faced there is that the researcher that conducted the sampling campaign did not pre-visit before. So yeah, me as well, I had no clue how it would be to be in a mine. So it was of course on the go during the sampling campaign. You get used to it, but in the beginning it's very difficult to imagine then how everything works. Also, again, there was a language barrier that none of the researchers who performed the measurements, so including me, I could speak the local language, which again made the communication difficult. Another part was that the sampling method had to be adjusted due to the unique environmental conditions of the mine. So for example, we really thought like, okay, we go down into the mine, we put on the stationary pumps, and then we just wait there for 7 hours and then go up again of the mine. But of course, we did it. So we went down, we installed the pump, and then I remember looking at my colleague, and we were like, yeah, we're not gonna be here just for 7 hours straight, because there you cannot. It's an attic zone, so we cannot bring any phones or anything, so, or computer or something. So yeah, we could not do anything, and only sitting there for 7 hours with also no idea of time. It's very difficult to do. So we really adjusted that way of sampling to really timed the pump so that they will stop and start directly without an interference of one of us. So, and also something to mention is that, of course, we really went down into the mines. We went to really the part where they extracted the coal. So yeah, of course, we will probably also be exposed during that sampling. So the key learnings there was that flexibility is essential during the sampling campaigns, and of course that the condition may change. So, for example, we had then to descend into the mines at different times depending on the shifts that we then wanted to follow. And of course that the safety precautions are critical because collecting samples sometimes also requires to put yourself in potentially dangerous situations. Then the next sampling campaign, it was a sampling campaign where the workers worked 8 shifts per day, and we followed the same sampling plan or similar as before. But the challenges that we face is that because of there were not many workers within the same shift, that we decided to conduct double shifts as a researcher, which means that we really were there from 5:30 in the morning to 10:30 in the evening, which is really intense. And also when we then draw the post-shift blood samples, we also had to then still process these blood samples and to process them also at our lab. So of course these was very long hours we had to do in that moment. Also something that we saw there is that the union representative were not informed in advance, and this resulted in an unexpected visit during the sampling campaign, which was not such a a big challenge because we could explain very well what we wanted to do, but I had the feeling that it would have been better that we talked with them before being there really sampling the workers, because it can have some problems later on. There also observation was possible, so we could really follow the workers during in the whole company. But the problem was there that the workers were divided between 2 production halls, and this also required a larger team to monitor them. So you can really see also in the picture that we could not do it, for example, with 4, but we really had to go to 6-7 people to really perform the sampling campaign. Also, we placed there then stationary pumps in the office space, and it was the first time we also got a complaint that it was a quite loud noise of the pumps. Before we did not have it because in production halls the noise is also already a little bit higher, but in office space it's always a little bit more more quiet, I have to say. So they complained a bit about the noise. So it was also very interesting point that we got there. And also in the sampling campaign, the data analysis and reporting were significantly delayed because of the limited number of researchers assigned to this task. So this was also something that we maybe should have been discussed before with the company, to really say, okay, we're gonna perform the sampling campaign now, but the results will not come within, for example, months. So key learnings we had here is that the oral exposure cannot always be included because the workers really did not follow some breaks, but they really went out whenever they want to go smoking. And also you see on the picture that we have some cups where they mix their paint, but they also use these luckily unused cups, but also to just get water or to drink coffee. And so it really it was very how to say, special to see for me that you in one pot you mix the paint and spray with it, and the other one you drink coffee with it. It also, again, mistakes can happen very easy in that way. Also, here in the sampling campaign, we could follow the same workers across 3 days, which was very interesting for us. And it also revealed that no days are identical, and that it really, again, highlights the importance of the observation, because at one point, so we divided the workers into different similar exposure groups, but because at one point, so we followed, I think it was around 50 people, one had made a mistake, and they decided all to help that person to get rid of that mistake. So they were all cleaning with methyl ethyl ketone, so a solvent, to really clean the whole surface. But if we would not have known that or we would not have observed that, then of course it's very weird to see day one like 20 peaks in the air sampling, and then on Wednesday we only see 1 peak of methyl-ethyl ketone. If you don't observe it, you don't know it. And also on that point, we also learned that researchers cannot work effectively without coffee. During the first sampling visit, I saw that in the production hall there was no coffee machine there, so we really brought our own coffee machine so that the whole team could work very well during the sampling campaign. And this is also something that I wanted to show, that during the communication of the sampling, also there was a question raised. Because the workers, they were doing an immersion of materials in the methyl-ethyl ketone bath. They did it around 1 minute, and the frequency was 10 times per shift. But the question was then, normally they are wearing no gloves. And then the question of the company was really like, can you show it what the difference is between some natural gloves and then some very good barrier gloves? So we really could do that on site, do some measurements there. So it's very an advantage that we can also then sample some really real work situation. It's a little bit more controlled than following the workers, of course, there, but it was very, very nice that we could really also do it there, and that we could really show with data to the workers that there's really a difference between wearing a good glove versus a bad glove. Then the next sampling campaign, we went again to the mines because I think we liked it, and we followed the same.
Rani, so how long do you think you still need?
I think 10 minutes or something.
Because we are now at 10:20, but So
okay.
Try not to take too long.
Yeah, okay. So then we went to the mines, and there the challenge that we faced is that the initial sampling plan was based on a first visit, of course, and there the distance between the farthest point was then on that point 10 minutes, but when we went there it was months later. The first point was at that point 60 minutes walk, so it really affected again our sampling plan, of course. Again, no observation was possible because we really had to just go down in the mines and then just start the pumps. And it's also led that some workers opened our casellas just to check, I think, the content, not to interfere with the measurements, but only just to see what is really inside, which then required again an additional trip to the mines. So showing again that it's better to explain to the workers up front what we are going to do there. And also there was some scheduling constraints, so we were only could do 3 days there for the sampling campaign, which made it, I have to say, very intense for the researcher to manage all the activities in that short time frame. Some key learnings again. So there was again some language barriers, but we had a strong connection formed with the HSE miners. I had the feeling there because they also understood very well the importance of the sampling campaign, but also to maintain that that there was a calm and positive atmosphere to also prevent the panic of us, for example. And also, previous experiments cannot guarantee that working conditions will be the same across the different sites. So then we went again to the firefighters, and then based on the previous sampling campaigns, where I told you that we did not know on that moment very well how to do the pHs inhalation measurements, we could do, we changed the place of the pump and we placed it inside the container, but one of the plastic holders melted due to extreme heat, but the firefighters really followed it up for us during that process. In that sampling campaign, it was a bit difficult because we had 2 research questions, and it was divided of 2 different individuals that took care of that, and there was not so much communication between the 2 persons before the sampling day, and I really felt that coordinating as a single team or as one team would have been more effective. So the communication, I had to say, with the firefighters was excellent. The shift leader was informed of the sampling plan in advance. And also, there we had we all spoke the same language, which was very nice to really connect also with all the workers. And here, yeah, 2 of the 5 researchers never had conducted a sampling campaign before, which also introduced some additional challenges because, yeah, you can always plan something, but yeah, you always have to deviate a little bit and you cannot stick 100% to the plan. And yeah, you are still working with humans and not with yeah, robotics. So this was also something that I learned from that part. So one of the last sampling campaigns that we did is that we also followed the workers there for 1 shift, but the transport of the samples to the lab and the post-processing took again longer than expected because the company was quite far from our laboratory. We followed them during different shifts, so early, late, and night, which affected a little bit our biorhythm, and also I learned there to not plan too long days after each other. And at some point, the researchers also forgot that, or yeah, me actually, I forgot that the company restaurant was closed during the evening. But yeah, the workers and the shift leaders really helped us by offering a Belgian solution. So they really could arrange that we got some fries from outside and get it inside of the company, which was really nice. And then also the passive samplers remained in place for several weeks, and which also required, again, clear communication with the shift leaders and workers to ensure that they were not removed. And also 2 types of spray paint were used, which have not been considered in advance, again, requiring an additional sampling day. And then here the key learning was that it was the first sampling or longer sampling campaign that everyone spoke Dutch, and that was actually very nice because the workers in the beginning were very hesitant to collaborate, but over the time we really had a trust relationship, and they became very enthusiastic about explaining their work and even invited us to lunch with them. And also I had the feeling there that positive experience spreads quickly because, yeah, on one point we were searching for controls and we were able to really have there, I think, around 50 workers, just because simply walking through the production hall, and other workers were very eager to just participate after hearing such a good feedback from our colleagues. So, and then the last one, so here, so it was some more difficult because we had shift workers, but we had also normal day shift hours. And here the challenges that we faced was that we'd also decided here to do a pre-shift blood sampling because of the contaminant that we wanted to search. And therefore we had to do the blood and the urine processes on the site. So that required that all the lab equipment we had to be transported to company, which also again was some to arrange everything was not so easy. We followed again the workers for 2 shifts, but we were allowed only 12 hours at site, so that also reduced some study flexibility. And the site was in an ATEX zone, so restricting phone use, but the communication we could do via walkie-talkies. And then the different workers were followed across different shifts, so we had extensive planning, and also accurate labeling was essential for this campaign success because, yeah, there were different workers that coming from different shifts, so it was very important to still have the overview. Here we had a very effective pre-campaign communication with several meetings with the HSE personnel, but also the engineers, the team leaders, the workers, and also the union representatives. So that was very good to start in this way the sampling campaign. Also, the workers actively collaborate on finding the best way to measure the contaminants, so they were also very enthusiastic to collaborate with us. And the on-site sampling processing was more efficient, but we needed to also bring then someone extra to manage this task very effectively. So I have some main takeaways, but yeah, it is within the stories I told, so I will go very quick through it. But yeah, so effective planning is very crucial. That's what I mentioned, I think, a lot. So also flexibility and adaptability is very important. So no 2 days are the same. So we really have to be flexible and adapt, but also make sure that we have the time to note everything down where we deviate from the sampling plan. And yeah, I mentioned a lot, but communication is very important. pre-sampling, but also during sampling. And it's always very important that you communicate as one team, one mindset. And yeah, some logical considerations are also very important, but these are also things I think that you learn by experience. And worker participation and engagement is also very important. So yeah, you really have to say to the workers that we want to observe them, not to control them. So we are not like from the government or something, but that it really makes us easier to interpret and also to trust the samples that we took. So that's also some main takeaways I want to give. I also had a step-by-step approach, but you can get it later in the slides that I will provide. But it's really a summary of what I told now. And I think this is how I want to stop this presentation. So it is really important to show respect to the workers. You have to give it to get it. It's really, really how it works. I had some really good connections with the workers with spending time with them. And I hope they also thought about it the same. And another thing is the secret to success is a good team. You cannot do it on yourself. You really need to have a team, and you really need to have people that also understand what we are doing. And this is what I just want to end. So I want to thank you for your attention, and I'm very sorry that we got over the time.
Thank you, Rani. Very nice presentation. I think really the real life of a researcher on the field. But I see a few questions here. First one is about the standards requirement field blanks as a minimum extra on every 10 additional samples, and about you can read yourself the LOD, LOQ of the methods. So what can you say on this?
Yeah, for the field blanks, we just followed the standard. So depending on how many samples you take, you have to see how many blanks or field blanks you need to take. I think also Stephen answered that in the chat, but we just followed the standards for that. Yeah,
and it's certainly the LQs and LODs is depending on the method you use for sure. I'm not sure, is this clear enough answer? So maybe you can react in the chat platform. And I see also a remark or a question from Susanna. So excellent, Rani. Thank you for nice presentation. So it's more a remark than just a question. Yeah. I think what you want to show is that it's really an experience to do these field studies, and especially maybe not stressed enough in a more academic or research context where there is not for the company often the need to go there, and that's why it's so important to convince people the importance of the research, and maybe also in the long run for them. That is, I think, what you want to say. But it is also a whole organization as people doing this type of research. You all know this, but there are many things, and you really need a road book maybe to really roll it out every time, and it's always different. That is what you want to say, I guess. Yeah.
Yes.
Okay, thank you. So any other chats? No, I don't see any questions in the chat. Neither in the Q&A. I think no. Okay, good. So we are a few minutes late. So maybe I had to be a better time manager here. But I think it was important that everything could be said. So I thank you, the two speakers, for the good presentation. I thank the audience to listen in, and hopefully you learned some things from these presentations, both the more theoretically and the practical points. And so hopefully we see you during the next presentation of our week. So the European Occupational Exposure tool is going to be presented this afternoon. So thank you very much and see you later. Bye-bye.